Hello.
Hi,
Hi, Andija. How are you?
I'm doing really well. How are you?
I'm doing great. So, first of all, if you would like to introduce yourself to our viewers.
Sure. So my name's Indija Nima. I'm from Louisville, Kentucky. I'm currently doing residency in Jacksonville, Florida at the Mayo Clinic. Um, I got to know about this program and I was very interested in getting involved. So hello, everyone, and thanks for welcoming me on this platform.
Oh, thank you so much. We welcome you. So, today our topic is to know more about the residency interview questions. So, the first question which I would like to ask from you is, for example, if any program asks about, tell me about yourself. So, what do you think? How long the answer should be?
Yeah, so I think a general principle overall that I like to follow for interview questions is no more than 30 to 45 seconds for an answer. Um, And that's just because you want to cover a nice broad array of questions, and then you want to make sure that they're able to ask all the questions that they would want to ask. And so if you spend 2 to 3 minutes on a question and you're very repetitive, that cuts out on your own time in order to shine. And so I'd say
Got it.
30 to
Okay.
45 seconds per question. If it's a complicated question or something that you're very passionate about, it's okay to go to a minute, but really nothing over a minute. People generally don't pay attention um, to too many details after a minute.
Oh, got it. So what do you suggest if the interview is for 30 minutes
If an
with a
interview
single
is,
person?
yeah, so even if it's for 30 minutes, I think when I say answering a question, it means, so say someone asks you a question and you respond. A lot of times, in like good quality interviews are ones where a conversation will get provoked through your answer. And so if your initial answer itself is 2 to 3 minutes and taking up a lot of time, they might have some 1 or 2 points of conversation, but it won't flow as much. Generally, when
Mm-hmm.
you're speaking to someone, it's you're speaking for a little bit, they're responding, and then you respond to what they said. So really to allow good fluid conversation, I would say still keep it to that, 30 seconds to 1 minute timeline.
Okay, sounds great. Thank you so much. So the next question which I would like to go through is, for example, if any program asks about behavioral questions, like tell us about what do you know about abortion laws, not such, sorry, not for abortion laws, but they can specifically ask, like, what do you have any opinion about abortion laws, or what will you do in this specific situation if where you have to do an abortion? So how should we tackle this answer?
So I think a big thing is make sure you're honest with your response.
Okay.
There's no correct answer, and they're not necessarily looking for um, if you fall in line with exactly what they're thinking or not. I think it's more of thinking of your approach to a certain situation and how you would deal with it in a professional manner. So say your opinion is that it is a woman's choice, then you can say, I think that it's a woman's choice for abortion. And
Mm-hmm.
so, and then you can explain your thought process on that. But you can also say,
Right.
however, if I don't agree with abortion myself, you can say, as a physician, it's my responsibility to give my patient resources. So you
Mm-hmm.
by no means have to ever do anything that is against your own interests, but it is
Mm-hmm.
important to give resources and communicate properly with the patient. So in your answer, if you want to be more diplomatic with your answer, you can say, I personally don't agree. However, I will make sure that my patient stays completely informed. Um,
Mm-hmm.
I think any behavioral question, if you phrase it in a way in which patient care is the center of your thought process, it'll always be a winning answer.
No, got it. Okay, sounds great. So I guess this is one of the best answers which we can give to any program if they ask about abortion laws or abortion stuff. So yeah, so next question which I would like to go through is one of the a new question which a few programs are asking. They're asking about, tell us any subconscious bias which you have improved recently within the past few months. So what do you think can be an appropriate answer for this?
Yeah. So I think just a general structure, and then I can give an example
Okay.
for myself. So the general structure I think I would say is here is a bias that I noticed, and sometimes it's
Mm-hmm.
helpful to show the environment in which you had that bias. And then you can say why you had it, but very, very important to include is
Mm-hmm.
how you no longer have that bias or how you are
Mm-hmm.
working towards resolving yourself of that bias. Okay?
Got it.
So in
Okay.
a healthcare setting, I think a good example is, and you see this a lot in the United States, is probably
Mm-hmm.
drug dependence or alcohol
Mm-hmm.
dependence and substance use in general.
Okay.
The way that a lot of these used to be phrased is by calling it substance abuse or a substance abuser and labeling a patient specifically as one of those things. So I'll
Mm-hmm.
start over just clean as my own answer. I can say, thank you for that question. I will say, growing up in Kentucky, we had a lot of issues with opioid usage and opioid abuse. And so sometimes we were taught biases, such as assuming that someone is drug seeking, or I might say myself have maybe come up to that bias that someone was drug seeking just based on how much pain they were
Mm-hmm.
having or if they were repeatedly going to the emergency department. However, after several interactions with specific patients and learning their individual stories, I realized that that was an internal bias that I was having and was getting in the way of me giving proper patient care. And so I try to stay conscious of that fact that I have the bias and make sure to address every patient's needs, especially pain needs, with more acuity than I had in the past. So
Yeah, got it. Okay.
yeah, it shows that you've acknowledged that you have a problem. No one is perfect. No one is, this Gandhi of,
That's true.
being good to everybody. But you have to I think there's a lot of growth shown in recognizing that you have a problem or you have a bias and that you're working towards fixing that and also working towards um, just being a better person yourself for your patients.
Got it. Okay. So there is also, I would like to share, there is a study going on. It's being conducted by Harvard Medical School. So they have their own questionnaire which is circulating over internet, and the people can have an access to that.
Hmm.
Uh, you have to answer a few questions, and at the end you will be able to know what's your subconscious bias. So
Mm.
all the people, if you do not have, if you don't know what's your subconscious bias, just search on Google, and you will be able to know that what's your bias, and you
Yeah,
can
I like
work
that.
on that.
I
Okay,
like that. And I also think saying I don't have any subconscious biases is kind of a lazy way to answer that
that's true.
question. And I don't think it would be well received by a program by saying I have no biases, I treat everyone fairly, you know, this
Yeah,
don't put yourself on a pedestal.
yeah. That's true, because even when we see our own countrymen, we become biased towards them, and so
Mhm.
everybody had their own bias. So it's completely normal to have a bias.
Yeah, I agree.
Okay. So the next question which I have is, so a few programs also ask, like, what do you do when you make any decision? So how do you make any appropriate decision?
Okay. This is a very broad question.
Okay.
Um, so I think a lot of these questions, when they're behavioral, they have a lot more impact when you have some
Mm-hmm.
kind of personal story or personal instance in which you had to use a certain kind of decision-making process in order
Mm-hmm.
to take care of a patient or whatever it may be outside of it. And so, actually, something that's very good also to do, because these are a lot of medical-based interviews,
Mm-hmm.
and every story that everyone else tells is a medical story. So if you have a story outside of medicine, like you were on a team, you played a sport, and you had some kind of story, this would be a good time to bring it in. It shows part of your
Okay.
personality, it shows your interests, it shows that you are doing something outside of medicine as well. So, I think something that could be a good example here is, say you were in some kind of leadership position, either in a volunteer
Mm-hmm.
leadership position or something else that's on your CV or maybe not on your CV. This would be a good question to bring that experience in.
Got it. Okay.
Yeah. So you can say, when I was in a leadership position for this organization, we had to decide who would go and do which tasks or something. And you can say, as leader, it was one of my skills is trying to find the best qualities out of someone and trying to
Mm-hmm.
find what they can do the most efficiently out of the group. And so, after a full discussion and also direct conversation with each member, we finally decided which position each person would carry. And that was not
Okay.
only done through my decision making as a dictatorship style leadership, but rather through direct feedback from the different members, and then also my
Mm-hmm.
input all coming together so everyone could be on the same page. This is a very
Got
generic
it.
answer that I'm giving, just so you can structure it based on whatever your own personal experiences you have are.
Mm-hmm.
However, it shows that you are using different skills that you have, and you also held a leadership position, and it gives a little bit more of a specific, tangible example for the
Mm-hmm.
interviewing person to remember you by.
Got it. Okay. So, for example, if any program specifically ask that, could you please tell us one of your best experience with an open ground? They're not mentioning that, please tell us your best clinical experience. So, what do you recommend in this situation? Should we mention any clinical experience which we have recently in any hospital,
Mhm.
or should we stick towards uh, the stuff which we love doing, like our hobbies?
I personally like the latter. You can,
Okay.
and in a way, you can sometimes address both by saying, I've had a lot of amazing clinical experiences. However, I kind of want to give you a little bit more insight into my personality and
Okay.
say, I love traveling. So last year when I went to, so for example, I recently went to Mexico.
Okay.
Last year when I went to Mexico, this was a trip that me and my sister have been planning for almost 2 years now, and we finally were able to go together and we had time together. It was a
Mm-hmm.
great family bonding time, alone time with her, which I hadn't had in many years, and was also so impactful because I was able to, use my Spanish again. I speak Spanish, so I was able to use my Spanish and feel more integrated into the culture. Additionally, the food there is amazing, so that was an incredible experience, something I definitely won't forget. So
Got it. Okay.
this is a real story. I'm saying this pure experience that I had.
Oh,
But
okay. Got
the
it.
way that that will do is someone will most likely be like, "Oh, that's so cool. Where did you go in Mexico?" And then you can have just a normal conversation about something you were doing. So if you
Mm-hmm.
always give a medical example or a research example or some kind of volunteering example that's already on your CV, a lot of
Mm-hmm.
these things are not conversation starters, and
Mm-hmm.
they're not going to give much fruitful back and forth friendly conversation. A lot of them,
Okay.
if you say, oh, like in clinical experience, I had this great preceptor who was so great, I was so excited. What else will you ask about that? That's such a universal experience that it's not very exciting and new and memorable. So, to answer
Okay.
your question briefly, I really like non medical answers to a lot of these questions. If you feel
Okay.
awkward giving a non medical example, you can always say, I love my medical experiences, but here's something else that I also do.
Got it. Okay.
Yeah.
So it depends on like how you structure your answer, how you frame it, right?
Yes.
And so here we have a one question, Sapkota Suhail. He is asking, if a senior decides to give Lasix to AKI with heart failure, what will you do?
Oh, okay. So I think this is less about the actual situation itself in that a senior gave Lasix during an AKI and more testing how you respond to any questions with conflict with a colleague or someone who may be at a higher training level than you. So my answer would most likely be I would try to pull the senior aside, privately,
Mm-hmm.
have a direct conversation with them, let them hear my approach to how I would treat the patient, and ask why they chose the approach that they chose. And if they're able to give some tangible example or meaning, then that's great because in that case, I've learned something new. And if they're not able to, then I'll try to give my information on why I think my approach is the best approach. And most often than not, in a medical setting, everyone is collegial, everyone is in,
Mm-hmm.
a good learning environment. So we'll come to some kind of consensus together. If we don't come to some kind of consensus, at that time, I'll try to pull in another colleague to talk to us. And if that still
Mm-hmm.
doesn't work, and I feel that the patient care is being undermined, then I'll go ahead and try to talk to an attending or someone at a higher senior position.
Got it. And I also believe like all the behavioral questions, they don't have any specific right answer. It's just how you tackle that question, right? And
Yeah.
they just want to see that even if you don't know the answer, that are you the person who can handle the question or not,
I think
right?
a lot of times for these behavioral questions, they want to make sure that you, one, will not throw anyone under the bus. Meaning,
Mm-hmm.
and what I mean by that is that you're not going to be someone who just confronts and doesn't try to see the whole picture and doesn't do
Mm-hmm.
it in a respectful way. Any
Mm-hmm.
answer you give, if you say, I will respectfully try to give good, open communication back and forth and see what happens at that point, well, I think that'll always be a fine answer to give. Um, I don't know the point of these questions per se, or what people actually get out of them as an interviewer. However, there's
Mm-hmm.
definitely a wrong way to answer them by saying, "Oh yeah, I would just tell him he's wrong," and then
Okay.
escalate it to a senior, or escalate it to an attending very quickly, because people are looking for um, applicants in whom they want to work with, right? So
Mm-hmm.
they want to work with people who are going to foster a collegial, respectful environment,
Mm-hmm.
and not with someone who is always blaming or trying to shift blame from themselves.
Yeah, that's completely true.
Hmm.
So I would like to ask another question from you. For
Yeah.
example, if you are a program director of any program and you are interviewing any candidate, so what three qualities will you look in that specific candidate?
Okay. And this is the program direct. This is the interviewer asking the applicant this question.
Yes.
Okay. Okay. So I think just structuring this question, I think you can try to highlight skills that you have or skills that you
Mm-hmm.
feel strong about, and label them that way, and then maybe talk about how you have those skills or how you shine in those things. So
Mm-hmm.
one can be, say, this would actually be a very specific question for some international medical graduates who already have some training experience or have already been working for a couple of years. Sometimes I think the fear here is that if they've already been working for a few years in a different place, also already as an attending position, it is hard
Mm-hmm.
to teach those people new things as a resident, because you
Mm-hmm.
already are used to being in charge, making all the decisions independently and not getting help. And so if you're in that boat, it's very important to let the program know that you're very teachable, that you're flexible and you're willing to learn. And so one quality can be, I think it's really important for a applicant to be teachable. And I know that I have this experience of being an attending already. However, I'm always willing and open to learn. And then you
Mm-hmm.
can say
Okay.
next point. I think a next point that's really important is that someone is reliable. Patient care is
Mm-hmm.
something that never stops. And so you want to make sure that there's people who will show up and will show up on time and will put their best foot forward every day.
Okay.
And then you
Sounds
can
good.
say one other point or something, like maybe organized, or whatever else you believe is a good quality and a quality that you also have.
Got it. Okay. So these are the qualities which every program want in their residents.
Yeah, and these are just example qualities, but
Mm-hmm.
I'm mostly saying it for the structure of it, in that you want to say, I think this quality is very valuable, and here's why I have that quality.
Got it.
Next
Okay.
quality. This quality is valuable, and here's how I embody that quality.
Got it. So yeah, we got a very valuable question. So I can't pronounce the name. They're saying, what's the most presenting problem in medicine today?
Yeah. So I'd say for this question, what programs are trying to gather is that you have some kind of understanding of the news around medicine, that you are not just a robot who knows, the clinical side of medicine, but also someone who pays attention to what's happening around the world. So there's a couple of examples that I think are very good examples for this answer. Something that you can say is insurance, how
Mm-hmm.
in the American system, care is really sometimes based on the type and quality of insurance that you have. As
Okay.
physicians, we're always taught to take care of every patient equally and equitably. However, it makes it very difficult for us to do that in this system when patients are not, we're not allowed to give patients the same kind of care depending on what kind of insurance they have. So that could be a
Okay.
good example. Something else that you can give an example of is, if you are passionate about something, like we talked about abortion before, you can talk about that as an
Mm-hmm.
option. Um, that's a little bit more of a polarizing situation. So unless if you strongly feel one way or another, maybe don't talk about abortion or more polarizing
Mm-hmm.
situations. You can also talk about health literacy, how people in bigger cities tend to be more health literate and tend to get better care versus smaller cities don't have access to physicians or are not taught good health literacy, and so they tend to have poorer outcomes. Um, a lot of different topics, I would say, but the biggest thing is to make sure that you're a little bit read on what's going on in the United States.
Got
One
it.
other question that I've also been seeing is, what do you know about the insurance system in the United States? Do you
Mm-hmm.
know how how it's structured? Or sometimes people will ask, do you know what Medicaid is? Do you know what Medicare is? And they'll ask
Okay.
if you know the differences between the two. This is not something that comes up very commonly, but if it does come up, it's nice to at least show that you have done some background research, basic research on how the American healthcare system works.
Got it. Okay. And what
Mhm.
about mentioning about the physician shortage? Because even
Yeah.
I, as a physician, if I want my own primary care doctor, I would have to wait like 3 to 4 months on an average to get a new physician.
Hmm.
So what about talking
Yeah.
in an interview like this?
Yeah, I think that's a very good topic, and I think especially if you're wanting someone to hire you to become a physician to address the physician shortage, that's definitely a good topic to bring up. Also, this if you want to bring up physician shortage and you are interested in working in primary care, or you're
Mm-hmm.
interested in working in more rural settings where that shortage is really the biggest, has a large issue,
Got it.
then I
Okay.
think that would be a good time to highlight that quality of yourself. I wouldn't say like lie about it if you don't, because
Mm-hmm.
what is the point of that? But if you are someone who wants to do those things, then let yourself shine there and say, the physician shortage is a really big problem. As you said, people are having to wait a long time just for a simple primary care visit, and my goal really is to become a very good, well-trained primary care physician so that I can address that shortage and I can fill in the gaps where care is
Mm-hmm.
needed. And then,
Got it.
I think that's a great example too.
Okay. Sounds great. So we have another question. Share us an incident where you have to break others' confidence. How to answer this?
Meaning like
I also did not completely get the question.
um
Share us an incident where you have to break others' confidence.
maybe when you have to when you have to tell something that someone else said that might be a secret or something.
Might be.
Okay. So I don't see this coming up as often in a healthcare setting unless if it's some kind of issue that's going to lead to like a large patient care failure. Most times there's not many secrets of things that are going on in the hospital. However, if someone needs to be reported for something, I think there's a way to escalate it and answer the question
Mm-hmm.
in a way that
Okay.
you escalate in a normal paced manner rather than
Mm-hmm.
saying, okay, yeah, I'll report them and make sure that everything negative happens. So, an example I can actually give that's a more concrete example of a question that I've actually been asked in the past is,
Mm-hmm.
you've noticed a worker, no, sorry, a coworker coming into work smelling of alcohol, and
Okay.
you think that they may have drank before their shift. What would you do in that situation? And
Got it.
so you have the moral responsibility to address that situation. How you do so is kind of in the creativity of your answer, correct? So you can say,
Yep.
"Hey, I would talk to the provider directly to understand what happened and know exactly the situation, know if that's actually true what I noticed, so I'm not just assuming and incorrectly escalating a situation. If it's true, I'll have to let them know that I have to bring that up to higher authorities because that's not
Mm-hmm.
something that's okay in the hospital. It's not a professional thing for them to do. So I think any question like this where there's some kind of issue,
Mm-hmm.
the first step is always talking to someone directly.
Got it. Okay.
Okay.
Because the program they don't want a person who is always complaining or always complaining about others. So that's why it's better to talk to the person directly and see
Yeah.
if this is the actual situation.
Yeah, and I think a lot of misunderstandings overall
That's true.
get avoided and get resolved when you talk to someone directly and you figure out what the situation is. Um,
Yeah,
what is the point of escalating a situation if you could have just had a 5-minute conversation with someone?
that's true. Yeah, sounds great. So let's take our last question and finish this session. So what need to be changed in healthcare system of United States?
So I think this question kind of is similar to the one that we addressed before,
Mm-hmm.
the one about what is the most presenting problem in medicine today. Um,
Mm-hmm.
so we don't have to be redundant about that one, but I can give some overall advice,
Okay.
just for interviews and such. So I think a big issue is when you want to answer a question, you think that you have to answer it very professionally in a very metered, memorized kind of way sometimes because you're nervous. However,
Mm-hmm.
a really important thing to do is to practice with someone and actually say the words out loud. Because when you
Got it.
practice with someone and actually say it out loud, then you can get a little bit of feedback from that person. And even if that feedback from that person is not very helpful, you yourself hearing words and forming them in a certain syntax will be helpful so that you know that, okay, me saying it this way didn't flow, or I wasn't able to actually finish that sentence, or, this didn't sound right. And so if you never
Got it.
practice by saying the words out loud, I think that's a huge detriment to yourself, and you should definitely practice that way. One other thing is something that actually one of the assistant program directors told me is that talk to someone as though you're talking to a friend. Because a lot of these programs, the reason that they're giving you an interview is because they like your CV, they like your statistics, they like what's going on paper. They want to
Mm-hmm.
find someone that will be a good fit into their program, and they want to find someone that will, that they want to have a conversation with and that they want to work with. And so if you're just rigid and you answer questions very closely and then you don't really
Mm-hmm.
invite any area for conversation, I think
Okay.
that's where the interview tends to go south a little bit.
Got it. Okay.
Yeah.
And what about recording your own voice and listening afterwards? I know it's not a good idea because
Yeah.
we hate our own voice. So, but we will be able to know what shortcoming do we have
Yeah.
and we can improve that.
I think that's fair. I think that's fair to record your own voice and listen to it later. However, um, I'll say I'm probably not a fan of listening to my voice when I talk, and
That's true.
it makes you very heavily critical of yourself, which is not
Mm-hmm.
necessarily a positive thing. However,
Mm-hmm.
I think the reason that I say to get feedback from someone else, even if they're not medical, say it's your mom or your dad or your sister, whoever, even if they're not medical, they can give you feedback on just how the tone sounds sometimes too. Oh, you sound kind of fake, or you sound kind of very rehearsed and robotic. Okay, this sounds nice. It sounds friendly. One other thing is, especially for your strengths and your weaknesses, if you're having a hard time recognizing what your own strengths and weaknesses are, you can ask the people around you. Ask your best friends, hey,
Mm-hmm.
what are my strengths? What are my weaknesses? Ask your mom and dad. I'm sure they'll have a couple
That's
listed
true.
out for you. And so if you are struggling to find something, have a discussion with some other people and see. And sometimes you won't even recognize trends that you have until someone points it out to you and gives you positive critique.
Okay. Sounds great. Yeah, thank you so much for all these answers, and it was a very valuable discussion. And now I guess we can do the closing of this session,
Yeah.
and we'll see you later.
Yeah. Thank you.
Well,
Thank
thank
you.
you so much. And thank you so
Bye.
much, and have a great rest of the night. Bye
You
bye.
too.